Hello, Robert Waters, MD, here again, and I'd like to talk about food. We hear so much about food. What diet? Jenny Craig, South Beach. Which one is it? High fat, low fat? And I like to look at things from evidence. And I like to look at real life situations. And a way to do that is look at what did ancient people eat. And there's been quite a bit written on that, including in major scientific journals. In particular, there's one research group, the Eads, a couple of medical doctors, a man and wife, that have looked at the evidence from archaeological sites, looking at bone and dental metal, mineral levels, looking at various aspects of life, looking at primitive people that still exist in the world, and also looking at bog bodies, bodies that have been dead for anywhere from 5 centuries to 20 centuries, and looking at the stomach contents of these individuals and intestinal contents. And what is found is that people, of course, didn't eat any processed food. The second thing that's found is that they had very high nutrient-dense diets. In particular, they had 50 to 100 grams of fiber to feed their microbiomes, where today we're lucky to have 10 to 20, and I'm sure some people have almost no fiber in their diet when they eat at fast food restaurants 80% of the time. Then we can look at some evidence that's been gathered by people actually in real time. And one is the story on Victorian nutrition. One of the big stories we doctors tell people is that we have caused a massive increase in life expectancy, but we hide certain factors about that, and that is that what we've really done is reduced infant mortality and mortality before age 5, and not really increased the long-term life expectancy of 80 to 85 years, depending on the country. Now, this has been looked at in reference to Victorian nutrition. In the era of 1850 to 1880, very good records were kept in England. In fact, doctors did autopsies on every patient that died, virtually, and very careful autopsies that were recorded. And the doctors looked carefully. They didn't have magnetic resonance machines. They didn't have laboratory tests. They had their eyes, ears, and hands, and looked very carefully in the arteries and all of the organs and did microscopic work. And what did they find? Only 2% of people died from cancer. Now, that cries out for us to explain why it's now more than 20%, a tenfold rise. There was also maybe 5 to 7% dying from heart disease. It was a rare finding, coronary artery disease at death. So it's increased also dramatically. Now let's look at what people ate then. There's studies showing that basically, first of all, they ate only organic food. Second of all, they ate nothing but unprocessed, real fruits, vegetables, seeds, nuts, fish, organically fodder-fed beef, hogs, chickens, eggs. There was no processed foods. The most processed food there was stone ground grain, and they were not genetically modified, polluted with all kinds of pesticides and herbicides within the structure of the plant. They were ground to fairly large granules that had very large surface areas and therefore were digested very slowly and didn't release insulin. And that may be why these patients were very healthy. And yes, there was a large amount of infant mortality, that is, mortality before age 5, but if one attained 5 years, the life expectancy was very similar to today's. And furthermore, the Victorians were healthy up until the end, by and large. Now, there's always exceptions, but by and large, Victorians lived into their 70s and 80s and then suddenly died within days after their last illness, usually pneumonia. Now, we in modern times have cured the problem of pneumonia, although that is also questionable. And so we have eliminated accidents and infant mortality, but we have not really extended life, and one could argue that we have extended it, but at what expense? are people really healthy until they're 85 or 90, or are they doctoring much of the time? Now, in more recent times, from Victorian, there's a man named Weston Price, a dentist, who after his dental career in the 1930s traveled the world to answer the question, why are Americans' teeth so crooked and their teeth so carious as compared to primitive people that he had heard about? So he literally took boats and airplanes to distant regions, to New Guinea, to South America, to coastal Native Americans in Northern California, which at the time were still leading the primitive, original Aboriginal life. He looked at islanders in the Pacific Islands, and he looked at every mouth in those villages all over the world, including one in Switzerland that was isolated from the rest of Europe. And what did he find? He found the rate of dental decay to be only 2 to 5% in these people, as compared to actually 50 to 100% in modern European societies. And he also looked at what these people ingested for food and sent that food back to the United States, where it was analyzed in the laboratory. And what did he find? He found that native peoples, Aboriginal peoples, eat, again, very high nutrient dense food, very, very low in sugar, with absolutely no processed cereal grains. And he also found, after going back to these places after 10 and 20 years, that there was a rapid increase in dental decay, a collapse of the upper dental arch, and crooked teeth within a 10-year period. As a matter of fact, in his book, Nutrition and Physical Degeneration, he shows photographs of individuals in a family where the children span a 20-year period with, let's say, a 27-year-old daughter and a 5-year-old daughter, and he shows the dental arch of the 27-year-old to be a perfectly white ivory arch without any dental caries, to the poor little child with massive decay and crowded teeth. So I think between the evidences of bog bodies, ancient literature, by the way, also can indicate what people ate, Tacitus's Germania, for example, and the study of Victorian nutrition and autopsy data, as well as Weston Price, and as well as looking at other ancient societies. Finally, the missionaries like Dr. Dennis Burkitt in Africa and others in the New World in Canada, where people were still living in the old ways back in the 30s and even 40s, doctors noted that rarely did native peoples come to see them at the beginning of their missionary and medical work in these countries, but as the years went by, they started to see appendicitis, gallbladder disease, and yes, cancer. And even these doctors perceived to be related to the change in nutrition. We brought them white bread, corn flour, marmalade, and canned vegetables to help them, and help them we did indeed help them to need our broken medical system. So we know what to eat. We don't have to go and listen to advice from companies that trade on the New York Stock Exchange. This data is known from real life. And if we follow that advice and go back to our Paleolithic ancestry as much as we can, we will find our health will blossom. Our expenses for medical care will diminish dramatically, and we'll be much happier, healthier, and effective people.